last Monday. President Obama had the leaders of the House and Senate sit down with him, the heads of key committees that health care legislation goes through, sat down with them and told them what a high priority this was for him, that he was willing to spend his political capital and energies and advocacy to move this forward, but calling on them as leaders of the House and Senate to take up their respective health care reform legislation and to get it passed through both the House and the Senate before Congress adjourns for its August break. Now, that's no small task, but the leaders agreed to that process, to that timetable, and so that's big news in terms of keeping us on track. President Obama made health care reform a centerpiece of his campaign, as did John McCain and virtually every other presidential candidate in this country. We all know this needs to be done. President Obama has also said that he refuses to put this off. Some people said, oh, it's too big. It's too hard. Put it off down the road. Deal with other issues first. Well, clearly the economy is our number one challenge. But the President has clearly said our economic success, our economic recovery is absolutely tied up with health care reform. So we have to get this right. And you know, I think Americans are best when we are faced with a great challenge. And that is what's before us. And I think we are in search of a uniquely American and common sense and balanced solution. A good example. Recently, I had the last town hall meeting I had was with Congressman Clay and Congresswoman Emerson. I see some faces here that were joined us at that event. It was bipartisan. We were looking for common ground. And it's the kind of thing that I think has helped spur getting people involved. Many people are involved in this debate in a positive way that in previous health care reforms have been obstructionist. So the dynamic has changed a lot. Out of that meeting, and a good example, one of the top issues that came up was the shortage of primary care doctors in this country, and the need to have more incentives and programs to get them out there for access to health care. And I'm glad to say in this proposal before Congress now, there are important provisions to do just that. And over a year ago, at a meeting of my Congressional Health Advisory Panel, there were issues identified with regard to shortages in nursing, which we're acutely aware of, but there's a bottleneck in not having enough professors to teach in nursing colleges. So again, it's a bottleneck that was identified, and I'm pleased to say in this new bill, issues are addressed with regard to our nursing workforce. So a lot of good things have come out of the debates we've had here, but this has been going on across the country. So I think it's a good model to try to keep this as bipartisan as we can, to keep it solutions-based, and really address the skyrocketing cost that, frankly, are unsustainable. We have seen premiums double in 9 years, growing 3 times faster than wages. The average American family already pays an extra $1,100 a year in premiums to support a broken system that leaves 46 million people uninsured. That's not the kind of health care we need. These soaring costs also hurt our competitiveness as a country in the global economy. It has harmed small business that creates most jobs in our country and historically leads economic recoveries. In fact, there was a great article in the Wall Street Journal last week about entrepreneurs in this country. Some of the best innovators out there are being harmed because of not just the staggering cost, but some people that would otherwise go out and take a risk to make that new product, that new invention, are hesitant to do so because of losing their health care. So we're stifling innovation, some of the things we do best in this country, because of this broken system. So I think it's important that we continue to have this debate, but also that we really focus in on solutions and take care and really take advantage of this historic opportunity we have before us. And I don't have to tell all of you that our healthcare system is broken, but there was also a poll recently about people's confidence in their healthcare system. And we're the only industrialized nation that doesn't have universal access to healthcare. That's embarrassing.
Yeah.
That's embarrassing.
Amen.
And when you take a poll in those other industrialized nations that have access to health care, their confidence level in the polling is about in the mid-70s. In the U.S., it's barely over 50%. So there's a big difference, and people know it. They instinctively know it because they've experienced it. So I've kind of laid out the issue and the obvious, frankly, to many of you here. We have today some other folks that have joined us that we're going to hear from. Carol Widener to speak about the problems with falling into the Medicare Part D donut hole. Melanie Schuss to share her experience as a small business owner with a pre-existing condition. And Eric Freeman to share some thoughts about the need for healthcare reform in small businesses and challenges as a small business owner. With that, I believe we're going to start with Carol. Is Carol here? She is en route, I heard. Then we're going to start with Melanie. There she is. We heard you were en route. That's okay. We're patient. So please, if y'all could help her get through the aisle there. We all will. Please come up. Please come up. Let's give Carol a warm welcome. Thank you, Carol, for being here.
I, like many of you who are here, have trouble with your supplemental drug coverage. I went into the famous donut hole the first week of May. I'm retired. My husband's retired, but I have to keep working in my house and my garden. And I take some very expensive medications. I have 11 prescriptions, 4 of which I have to pay full coverage since May. I called last Thursday to renew a prescription that I'm supposed to take 2 times a day. She told me it would be $900. I told her I couldn't do that, that I'd have to do it monthly. And that's just one of 4 that are $200 and $300 a piece. I also have a medication that they will not pay for no matter what. It's very difficult to try and manage money for these drugs, and they are what keeps me going.